Well, what we can do now with IVF and the fact that we can make embryos, we can do testing to be able to look at embryos and determine genetic issues. So in some patients who may have genetic defects like cystic fibrosis, sickle cell, or even some much more difficult or complicated genetic diseases, we can actually go in and test a cell from the embryo to determine if that embryo carries that genetic disease. And obviously, if it does, that's not an embryo we would transfer. So essentially what you're trying to do is transfer back to a patient an uninfected embryo so that you could basically get rid of the disease process. Nowadays, we're moving to what's called blastocyst biopsy, where the embryo is now about 5 days in the lab, so it's about 80 or 100 cells. So you can actually remove several cells out of there to really get a better diagnosis, because you're basing everything off of one cell on day 3. When we get to a day 5 transfer, we have several cells to analyze, so we get a much more accurate diagnosis of the problem. Future of PGD is really looking at trying to get to the point we get the best pregnancy rates with IVF, and that's going to move into doing genetic testing on embryos so we can put back normal embryos, which clearly give us the highest rates for pregnancy success. So I think that now that we can do genetic testing, that the turnaround's very quick. We can biopsy a cell or set of cells from embryo within 24 hours. We can have a result of whether that's normal or not, or even at looking at genetic diseases. So we're moving into an era where we can really, people used to talk about worrying about designer babies and what are we doing to manipulate. I think that's far, far from where we ever are now. But what we really can do is make sure that we're putting back normal embryos, and in cases of patients who have genetic diseases, unaffected embryos. And I think clearly we're moving in that direction.